Good afternoon, namaskar, and welcome to another edition of our webinars in the series Illness to Wellness, which we've been organizing since been the backbone of our programs on health awareness, especially during the period of COVID when we were all bound to our homes, to our chairs, and we could not move out and during the period of lockdown, but we needed information, we needed authentic information, and we were lucky enough to bring to you from the medium of our platform opinions and advices of a few of the top noted specialists in different fields of medicine from India and from all over the world, I would like to say, because the specialists who've been coming and those who are present today as our esteemed panelists are very well known all over the world. And Dr. Anup Mishra, I would like to mention here, is one of the topmost quoted scientists, going by the number of his papers. So we have a very august gathering of panelists today. Uh, today's seminar, today's webinar is Diabetes Free India. Diabetes has been known to us since ages. It has been there. It has been described in our Vedas. It has been described in the Bible. And today we're going to talk about ways of making our country, which at some point of time was the diabetes capital, now diabetes free. So over to you, sir, Shri Anil Rajputji, who is the chairman of the Council of CSR of ASSOCHAM, who's been the guiding light and who's been our support throughout these programs of illness to wellness. Even before we started the webinars, since many years we've been doing outreach programs in communities. We've been organizing camps, doing tests, and giving guidance and giving consultation to citizens of our country, especially in Delhi. And thousands of people have benefited from these programs, and they have all been under the guidance of Sir Shri Anil Rajputji. So over to you, sir.
Thank you. Thank you, Dr. Kesri. It is an honor and a proud privilege for me to welcome Dr. Anup Mishra, Padma Shri, Chairman, Fortis CDOC Center of Excellence for Diabetes, Metabolic Diseases, and Endocrinology, Chairman, National Diabetes, Obesity, and Cholesterol Foundation, and President, Diabetes Foundation of India. Dr. Brij Mohan Makkar, Senior Diabetes and Bariatric Physician and Director, Dr. Makkar's Diabetes and Obesity Center, New Delhi. Dr. Sumit Arora, Consultant Pediatric Endocrinology, Artemis Hospital, Gurugram. And my long-term partner in these programs, Dr. Rajesh Kesri, Founder and Director, Total Care Control, Delhi NCR EC member, RSSDI. Good afternoon and a warm welcome to the webinar on Diabetes Free India, organized on the World Diabetes Day, which happens to coincide with Children's Day in India by ASSOCHAM under its Illness to Wellness campaign. This campaign over the last years played a significant role in making people aware and have helped them in making the right choices towards a healthy and fulfilling life. I will take this opportunity to thank our doctors and wellness experts who have provided strength to this campaign. They have been really the torchbearer for our program. Their active participation has greatly supported us in generating awareness and understanding several health-related issues. their early symptoms, preventive solutions, and possible treatments. As you must have read in the newspapers, Prime Minister of India recently called diabetes TB-free India. And I'm sure we will be able to, over the years, communicate to the government that we need to take this disease with similar kind of focus so that we create a diabetes free India. So I'm sure together we would be able to emphasize and impress upon the government to declare and take in their hands and bring out several steps which will make India diabetes free in the years to come. The active support of all our doctors, I am sure that we would be able to achieve our objective in years to come. Just to share with everybody, the World Diabetes Day began in 1991 by International Diabetes Federation and the World Health Organization in response to growing concern about the escalating health crisis posed by diabetes. Thereafter, it became an official United Nations Day in 2006 with the passage of United Nations resolution. This day is marked every year on 14th November, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. Frederick Banting also shares his birthday with our former Prime Minister, Pandit Jawaharlal Nehru, lovingly known as Chacha Nehru, whose birthday is celebrated in India as Children's Day. On one hand, while today is a delightful day for children all across India, on the other hand, it also reminds us of alarming rise in children being diagnosed with diabetes in our country, which has triggered critical warnings in families and health organizations. Diabetes is one of the fastest growing health challenges of the 21st century. Across the globe, the number of adults living with diabetes has more than tripled over the past 20 years. India is home to nearly 80 million diabetes. 1 in 6 people with diabetes in the world are from India. This number is expected to rise to a staggering 134 million in the next 25 years unless we all work together and take corrective measures. To make matters worse, researchers estimate that 57% of cases remain undiagnosed. This is particularly concerning as the risk of serious complications increases when people do not take medications to control their blood sugar. What is also distressing is that an increasing number of children are developing diabetes, with up to 90% of childhood diabetes being type 1, where children are dependent on insulin for survival. A recent report from Indian Council of Medical Research states that in India, around 95,000 children are suffering from type 1 diabetes below the age of 14 years and nearly 16,000 new cases diagnosed each year. Over the last couple of decades, there has been a tectonic shift in the lifestyle of families. High-calorie diet, unhealthy food, lesser physical and outdoor activities, have increased waistlines of individuals and critically amongst children as well. It is a dual epidemic as obesity is on the rise and blood sugar levels are increasing. While experts have coined the word diabetes for prevalence of diabetes and obesity in children, the World Health Organization has described the situation as exploding nightmare. A diabetic adult suffers from various health complications that include damage to large and small blood vessels, which can lead to heart attacks and stroke, and problems with kidneys, eyes, feet, and nerves. So, when a child is diagnosed with diabetes, the situation becomes precariously critical. Doctors have been warning about the sedentary lifestyle of adults and, in particular, children, which brings a host of health risks. Therefore, it is the duty of individuals, parents, and caregivers to give requisite steps and provide adequate care for healthy and happy living. Following a balanced lifestyle, which includes daily exercising, eating a nutritious diet, including whole grain, pulses, fruits, and vegetables, and low fat dietary products with proper hydration, along with weight management, adequate sleep, and mental stimulation, are all important steps in controlling, delaying, and averting the onset of this disease. Diabetes can be seriously underrated as a global public health issue, and the world can no longer ignore it. It needs to accept this reality and focus on addressing it head on. Despite the enormous growth in our understanding of diabetes and its complications, we are still far away from bringing the situation under control. Therefore, under these circumstances, this subject deserves our undivided attention. We are joined by eminent personalities today who are expert in this subject, and I once again welcome them and look forward to an enriching discussion. I wish this webinar a great success and thank you very much. Jai Hind. Back to you, Dr. Kesri.
So much, sir. Thank you so much for such an elaborate introduction. And you have very rightly pointed out the important topics which we should all be worried about, especially in context of diabetes. And we would definitely try to touch upon them, most of the topics in the coming discussion that we are going to have with our esteemed panelists. Once again, I'm very thankful to all the panelists who have joined us. Rajput sir has already introduced them. Here I'd like to mention especially that we are joined by Dr. B.M. Makkar. He is the president of RSSDI, that is the Research Society for Study of Diabetes in India, and that is the biggest organization of doctors treating diabetes, not only in India, all over Asia. More than 10,000 doctors are part of this organization, and he's the beacon and the leading light in guiding research on diabetes, especially in Asia and our country, India. And we are also joined by Dr. Sumit Arora. She is a consultant pediatric endocrinologist, and she'll be throwing light on diabetes in children and obviously Padma Shri Dr. Anup Mishra, we welcome you. He is the chairman Fortis CDOC Center of Excellence for Diabetes, Metabolic Disease and Endocrinology. He is the chairman National Diabetes, Obesity and Cholesterol Foundation NDOC, and he is the president Diabetes Foundation of India. And as I mentioned, that he is the second most quoted scientist in the field of diabetes. So welcome and thanks a lot to all of you again. Dr. Makkar sir, I would like to come over to you and I would request you to give a brief outline about insulin and, if possible, the story of insulin, how it was accidentally discovered, in short, so that we can carry on our discussion from there. Dr. Makar, sir.
Thank you, Rajesh. First of all, thanks for involving me in this important panel discussion. So, insulin, we know it's a life-saving drug for all people with diabetes, especially with type 1 diabetes, where the only treatment that we can think of is insulin. Now, actually, it's what you have asked me to throw some light on insulin. It is a full subject. It is very difficult to explain insulin in summary. Basically, whenever somebody gets diabetes, there are two major types of diabetes. One is the which we see in children, type 1, and that happens because of the deficiency of insulin. And they need to be treated with insulin only, and insulin is the life-saving drug. Second type, type 2, which is the most common type 2 of diabetes. Again, insulin being the key hormone which regulates, the glucose metabolism and also energy metabolism in body, is there is a relative deficiency of insulin and there is resistance to the action of insulin, and that is why the glucose levels go up. These people respond to the drugs which bring down the resistance to insulin, and once there is a significant decline in insulin production, these people also need to be given insulin. Now, insulin being an injectable medication till now, and till date we have not been able to find a solution that we can give it as a tablet or a capsule. There is always resistance to taking insulin as a part of treatment at all patient levels. Now we are able to convince type 1 diabetes people more easily because there is no other option and there is a threat to life. So uh, parents are able to understand more comfortably or more easily as compared to type 2 diabetes people, where everybody wants to try oral medications till it becomes necessary to go for insulin. But my only submission here, or my only point to be highlighted about insulin here is that insulin is another medication. In fact, insulin is more physiological than other medications because this is what is there in your body, and in people with diabetes it is deficient, so we need to give it from outside since this deficiency is not covered by other medications. So one should not try to run away from insulin therapy. What happens is, in an attempt to keep the insulin away, people keep on going with the bad control of glucose and ultimately end up with development of long-term complications, which not only increase the disease burden, they cripple the patient who is affected. There can be loss of work, there can be lot of suffering, and it leads to early death also. And there is of course economic implication for the family as well as for the person. So one should not try to run away from insulin. Insulin is a medication which works in all conditions, all diabetes, if nothing else is working. And you should understand that insulin is possibly the most important treatment option in diabetes when nothing else is working. So insulin, if somebody is offered insulin as a treatment option, one should not try to avoid it and keep on continuing with bad control.
Thank you so much, sir. Thank you for enlightening us about the role of insulin. So now we have this understanding that diabetes, whichever be type 1, type 2, or any other type of diabetes, because or relative insufficiency of insulin. Now, this insulin is a hormone which is made by an organ called pancreas in our tummy. So it's very important to remember these things: insulin, pancreas, and beta cells of pancreas. Now, once we have this understanding, my next question would be to you, sir, Dr. Anup Mishra. Now, we have very aptly termed the heading of our program today, Diabetes Free India. to make our country, where should we start with? Sir, are you there?
Yeah, I'm,
Dr. Anup,
yeah, but
Yes, sir.
your voice is
Please say.
cracking. So, can you repeat that question?
Okay, so what I was asking was that we have now learned about insulin, we have learned about pancreas, and today's topic is diabetes free India. So if we actually wish to make India diabetes free, how and where should we start with?
So, Rajesh, thank you for giving me this opportunity, and I'm always grateful for Rajput sir, always, and he's such a great presence and always encouraging. So, thank you. Well, I would say I'll be a little bit provocative here. I will say that to have diabetes-free India is a dream. Is not going to happen. It's absolutely clear. The way we are going will only increase. And even if you say that what should be our goal for restricting diabetes, the goal should be less than 5% prevalence. Currently, 7 to 8%, or in some places more than that. If we achieve that, we'll be a winner. Zero diabetes cannot occur. There is no way. But how do we do that? I mean, we have been seeing the National Diabetes Control Program, the 2014, and then revised 2018, and there are some very good things done during this time. You know, the uh, uh, the screening program in the 400 districts was done. There's some data released, but this has been up and down. This program is not intensified as diabetes has increased. And then this program actually doesn't have a, a definite component of containing diabetes. So sure, you can screen, get some people diabetes, early intervention, early treatment, tell them what to do. So that's all well and good. But how to contain it? This is the problem. That focus should be there. So what I sometimes back suggested to one of the top people in Indian health services, and the people said that diabetes is individual choice. You eat, you become diabetic. You don't eat, you don't become diabetic, or something like that. I said, but everybody should be provided a chance not to become diabetic. How do we do that? We have a 10-year commission of dedicated people. So maybe a couple of governmental people, a couple of people from the private sector, the public-private partnership, an empowered committee which goes on for 10 years. Mandate for 10 years. Don't mandate for 1 year. 1 year will do nothing to that. 10-year mandate. Have a plan. A plan should be that you don't get people to you, you go to the people. That should be the plan. So we have, and that's for Rajput sir also, who was saying that, and you were saying that a project should be there for primordial prevention. We have been carrying out a lot of projects in the underprivileged areas. Unfortunately, our project has finished, and that concentrated on women. So in such situation, we go to them. We have vans, and we go to them. We tell them what to do. We tell them, we also screen, we tell the people who are having diabetes how to treat that and how to save their feet and eyes and so on. So the people accept it. People accept it very well. Why do they accept? They don't have to go anywhere. They don't lose a day of wages. They don't lose some money there. And hospitals, some hospital will take money, some and all the investigation. So unless you do that, each city and suburban areas, you will not be a winner. There is no way that you can be a winner. And I'm looking forward to somebody contributing to such a program where we focus on women, we focus on primordial prevention. Uh, uh, Unfortunately,
In few words, what is that? What is primordial prevention? Because
Yeah,
most of our
yeah,
viewers don't know.
yeah. I'll come to that. So just let me finish that. That nobody in last 3 years has come forward with any grant. We have applied to several. Nobody. Now, what is primordial prevention? We concentrate on women of the house. The moment she is married, we educate them about the correct diet, about how to take care of baby's diet. So some people say diabetes starts in the womb. Uh, why does it? Because of inadequate nutrition, because of inadequate the environment. We make the environment better. So whatever chances are there for diabetes for this child are decreased. And this child has as much right to come in the world without increased chances of diabetes as anybody else. This is something not going to happen unless we educate these women who don't nothing, who don't know a thing about diet and exercise, how to take care of diet in the pregnancy, how to take care of diet in the newborns. So starting from there, this is our program. This was our program, and starting from there, then to younger people, younger children, all this should be a continuum and should, very interestingly, sir, Rajput sir, uh, I went to Sheila Dikshit when she was the chief minister of Delhi, and I told her, she knew me very well. I told her, you give me some money to buy 100 mobile vans where I can fit all equipments for that, and she was very happy. I said, give me a couple of years and I will decrease diabetes as far as Delhi is concerned. She gave the this thing to health secretary, and health secretary was not very this thing, so whole thing fizzled out. But this is what should be done, and this is what I suggested to somebody high up in this thing. But unfortunately, nobody is listening at this point of time. Yeah,
think
Rajesh. Go on.
Rajesh,
Sir, I could hear. Hello.
Yeah. Please go on. I finished
Okay.
my answer.
Okay. So actually, probably there was some problem in the connectivity. So, Dr. Makkar, sir,
we can.
well, I'd like to come over to. No, I'll come. Yes, you want to contribute something?
No, I just want to say that
Okay.
while Sheila
Yes, sir.
Dikshit
Sir.
is not there, Dr. Mishra, that we can together see how we can, go to various government ministries and see whether we can make some progress. We can
Yes, sir.
go to. I'm willing to kind of move and work together
Yes,
on
sir.
this activity. If we
This
can create,
I think would be a very interesting.
we
Yes.
can create a model state in the country.
Yes,
I
sir.
think it will be a great thing. At
Absolutely.
least
Yes.
we can revive this project together and see if we can make some meaningful contribution.
Yes, sir. Surely. Absolutely.
Dr. Makkar, sir, what do you think would can be the role of RSSDI in any such project for primordial focus on primordial prevention of type 2 diabetes?
See, I think Dr. Mishra highlighted a very important point, and first thing is that diabetes-free India is a dream, which is unlikely to come true. Important thing is if we can cut down the prevalence, that will be a great thing, and it will be a very, it will be a real win-win situation for the healthcare agencies as well as the profession and public at large. Now, primordial prevention is one area which is difficult to understand for average people and also difficult for intervention. And it needs a very comprehensive plan. And I'm sure Dr. Mishra, has that in place and he started working on it, but it didn't work. At RSSDA level, I think the most important thing that we are focusing this year on, and that is also in alignment with the IDF agenda of the World Diabetes Day, Educate for Better Tomorrow, So we are focusing on education, education, and education. We are trying to take this education on different aspects of diabetes to all possible, directions. And we are trying to utilize all possible resources that we have with us and that we can, lay our hands on. And if you are seeing what is happening today, actually, I even RSSD Delhi chapter group, you are getting some posts, but I am continuously monitoring what is happening through the country. So every single state is doing some or other program currently. We have had some of the walkathons in different states. We are having thousands of, free sugar checkup camps happening across the country. There are multiple educational programs happening. There are people who are talking to type 1 diabetes children. They are specifically running type 1 diabetes children program. They are running diabetes in women education program. So something is on continuously. In fact, it started yesterday only, and it is likely to go for at least this week and till the end of this month also. So a lot of focus is going to be on education as far as RSSDA is concerned. And I think uh, if we have to make a dent in kind of nailing diabetes to whatever extent we can, the mainstay has to be education about diabetes. Mainstay has to be about education about prevention of diabetes. Once it has happened, then we have to move to a different mode, and we have to focus on control, prevention of complications. So primordial prevention is, I think, the most important, and there the women health and women education is very, very important. And second thing is what one Dr. Mishra talked about is the undernutrition in women. But now other problem is that overnutrition. Obesity in women is also becoming a major challenge. And if the women are obese during the time of pregnancy, the offspring is likely to become obese and high risk of type 2 diabetes during childhood. So, educating young women during the reproductive age is again very important area that needs to be intervened. Dr. Mishra wanted
Thank
to
you,
say
sir.
something.
Yes.
Hi, hello, sir. Hello. If I may
Yes, yes, yes.
add on here,
Please,
um,
please.
thank you for having me, sir. So, from the pediatric world, I would just like to add on here because starting from birth till 18, they are all children are going for vaccines. So, at the primary health center junction where they're getting their vaccines, they always get their weight checked. But what is missing is their height that needs to be checked, the body mass index that needs to be checked. We do have growth charts from Indian Academy of Pediatrics that are Indian specific. So if we are able to um, point out towards parents and make sure that these growth charts are plotted from a very young age, we are able to catch these higher body mass index starting from very early. So the cutoff is like 5 to 18 years we have the body mass index charts, and 0 to 5 years we have weight for length charts. So from that standpoint only we can identify these patients or that these children who are actually getting to gain weight at a very early age. And we have seen that even those that have gained significant amount of weight at as early as 5, they end up developing a lot of symptoms, and they end up during their puberty developing diabetes or pre-diabetes. So that would be one area we can target also.
Can I say something?
Definitely. Thank you. Yes, sir,
Yeah,
please.
yeah. Absolutely wonderful idea. There's no doubt about it. That is something that needs to be done. Unfortunately, there is a problem. Now, you see as a prototype, tuberculosis, diabetes, co-infection, bidirectional screening, which is in the agenda for last 5 years. Now, if you see some of the research studies which have come for evaluation of the program, you see that in patients with tuberculosis, the all should get a screening done with diabetes because the prevalence of diabetes is 24 to 25%. Only 25% get the screening done, and that too only random blood sugar. So what is happening? And they have taken the statement of various workers, ASHA workers. They say, nobody has taught me anything. People are piling up all the work to one person. I don't have time for vaccination, what to do, anything else. This is the problem. This is the problem. They should be more people, more empowered, more knowledgeable. And this is such a thing that you are saying is absolutely possible, and we can detect early obesity.
Thank you, sir. And just I'd like to add one thing here, as we were discussing a lot about awareness, awareness, and awareness. As Dr. Maka has mentioned, we are doing an initiative. We will light up the tallest skyscraper in Delhi. It's a building in Noida, advanced hours business stuff, lit up blue and diabetes. So we all in our doctors community are trying to take various steps to create more awareness and do more educative programs like we are conducting right now. So, question to you, sir, Dr. Anup Mishra. The role of obesity in diabetes, you have done lots of studies, and especially your studies in children's and BMI are very popular. They're like textbooks for us. So tell us something for a layman, for a layperson to understand the importance of diabetes, fat, obesity, fat, and diabetes.
Okay, it's like this that we did a collaborative studies of multiple investigators when I was in All India Institute of Medical Sciences on the children and obesity and young onset type 2 diabetes. That was 2007. We published in Diabetic Medicine. And for the first time, apart from one study from the south, from Ramachandran's group, first time we showed that the age where type 2 diabetes is occurring in children is around 13 to 14 years of age. Of course, average age was 20 years or something. So this particular study plus other, and this is the start, and then number of other studies, and then ICMR program on youth onset diabetes. The only cause behind this type 2 diabetes in children was obesity and the waist circumference. And by taking a BMI and waist circumference and one more factor, which is triglyceride, if you see the person like this, a young child like this, you can predict that this person is going to develop diabetes. So this is a phenomenon which is unchecked, and there is increasing number of children which are getting obese. The moment they get obese, as Dr. Makkar has already told you, the insulin action becomes low. And up to a certain extent, the insulin will still keep the sugar down, but after that, the beta cell get absorption and the sugar goes. Of course, it is more often in those with the family history of diabetes. Here, we have trouble actually controlling it because these children are difficult as far as their lifestyle is concerned. It's difficult to control their lifestyle and difficult to make them exercise if they are not exercising. Behind that is two things. One, mindset of the mother, and also lack of enough education or pointed education or aggressive education regarding this in as far as the schools are concerned. We did another study where we found that those children who are obese, the 66% concordance means 66% their mothers are obese. If mothers are not obese, they are taking balanced food, they are doing exercise, fathers are doing exercise, everybody is eating together, and teachers also teaching about diet and exercise at school. And I have another idea, and that is that if we can combine with teachers, so one doctor, one school, and they can combine with teachers, this becomes more effective because children will listen to the doctor. If we do this, something like this, there's something needed. This is aggressively needed. In another study which we published in the European Journal of Clinical Nutrition, 6 months of this multi-component intervention led to decrease in their weight, decrease in their insulin, the resistance, improvement of insulin secretion. So it can be done, but very difficult unless school, teachers, government, policymakers, doctor, all come together. As yet, this is not happening. Rajesh?
Thank you so much. So in short, yes, am I audible?
Yeah,
Yes.
now audible. Yeah.
Short, if we can decrease, in short, if we can decrease obesity and especially that too in children, uh, a lot can be done about preventing
Rajesh, your voice is
for
cracking.
diabetes. So, am I audible now? Is it all right, sir?
Now it's better. Yeah.
Dr. Makar sir, can we have few words about reversal and remission, because this is a topic which is very popular these days. So can you allay some doubts and throw light on
So I think you raised a
reversal
very
and
valid
remission? What
point, and
is right? What is wrong?
you raised a very valid point, and you know, Dr. Mishra very nicely highlighted the relevance of overweight and obesity in people with diabetes. So if you look at the numbers of people living with diabetes in India or anywhere globally, for last 30 years we have been making projections at the level of IDF or WHO. And every time we have surpassed the projections for the numbers of diabetes that, have been done in last 30 years. We were supposed to reach the figure of 452 million by 2030, which we have already done in 2021. And one of the major reasons why these figures are going far more than what we were, projecting is the increasing prevalence of obesity. Obesity or overweight is a major driver for increasing numbers of people living with diabetes. And unless we do something about obesity, we will not be even able to curtail the increasing number of diabetics or people living with diabetes beyond the projections that we are doing. They will always be going far more than the projected numbers. Now, uh, obesity by obesity is not just simple body weight. One has to understand it is the abnormal excessive amount of fat that is there in the body. It is not just weight, and this fat is there in an amount which is harmful for the metabolic processes of the body, and the most important outcome is the development of diabetes. Now, we have clinical studies clearly showing that if we are able to reduce the weight by 10 to 15%, we can actually put almost anything between 50 to 85% people with type 2 diabetes in remission. That means they will achieve normal blood glucose levels below the ones which are cut off for diabetes uh, by this lifestyle intervention, that is diet and exercise. And if they lose 15%, but this should happen within the early course of diabetes. So studies have seen people up to 6 years with type 2 diabetes, if they are subjected to weight loss, weight management, and they lose, say, 15% body weight, there is 85% chance that these people can go in remission of diabetes. And again, this underlines the importance of controlling obesity or managing weight in management of diabetes or prevention of diabetes by reducing the obesity. So remission is definitely possible, but again, it is not easy. It requires a very concentrated effort. Earlier, we were not having sufficient medications to manage obesity. Fortunately, we are now going to get couple of more, very potent medications in India in coming years, and maybe we'll be able to do better as far as obesity management is concerned. But yes, diabetes remission is possible, and should be attempted in all people with diabetes who come to us in early course of disease.
Thank you. Thank you so much, sir. Now, I'd like to request Dr. Arora. Am I audible, Dr. Arora, ma'am?
Yes, 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 sir.
Yes, we haven't heard anything about type 1 diabetes. We understand the prevalence is less, but one, is it increasing the prevalence of type 1 diabetes? And two, is it possible, are there any ways of preventing type 1 diabetes?
So there has been actually a significant increase in prevalence in type 1 diabetes after COVID-19. So there was a rate of rise of 3% per year of incidence in type 1 diabetes, which has increased to roughly around 15% per year in type 1 diabetes in children and adolescents that we have been seeing. And majority of the centers across the globe and across India are looking at similar kind of trend that has been seen after COVID-19. So yes, there has been a significant increase. Now, talking about prevention, we are not able to prevent using any kind of dietary measures or any kind of medications, or losing weight will not help in preventing type 1 diabetes as such. What we talk about in terms of prevention is there are families that have a child who has type 1 diabetes and their own siblings or other children may be at risk of getting type 1 diabetes. That prevention that we talk about in them is still in the trial phase, and there are some drugs that have been used in research setting to prevent or delay the onset of type 1 diabetes, but we're not able to completely avoid the presentation of type 1 diabetes even in those settings also. And again, the medications that we are talking about are very closely monitored and done only in research settings. So for general public as such, there is no prevention then when we talk about type 1 diabetes as such.
Thank you. And there's so many things that I want to ask. This discussion has not been on the pediatric side. It has been, even though. Have you seen the rise in trend of type 2 diabetes? Can you tell me the youngest type 2 diabetic patient you have? Have you noted that more and more children are developing type 2 diabetes?
There has been a significant rise. Like I said, type 1 diabetes has gone up significantly, similar to that after COVID-19 because of the lockdown, because of sedentary lifestyle, and kids having behavioral issues, sitting idle, eating a lot. There has been a significant increase in type 2 diabetes as well by almost 100%, if I were to say so. And the youngest that I've seen is roughly around 10 years, if I'm not mistaken. So yes, there are a lot of children and in that age group that have just started their puberty that are developing type 2 diabetes now.
If you're talking about puberty, so what is the relation between word PCOS almost
Rajesh, your voice is cracking. Your voice is
every
cracking.
other girl that is related
Your
or
voice is cracking. We'll have to repeat the question. Sorry.
throw some light on PCOS. Okay, that's it.
So
PCOS, what's the importance of PCOS?
when we do talk about lifestyle related disorders, one of the disorder that we are talking about is polycystic ovarian syndrome, which when we talk about the definition, basically is related to irregular menstrual periods in girls that have already entered menarche and has been, after 1 to 2 years of their entering menarche or entering the first period, along with having high male-like hormone levels that are causing excess amount of acne or excess amount of facial hair. So that is PCOS. And why this happens during this age group is again a lifestyle related disorder that is similar to type 2 diabetes, and is for most part a result of significant amount of weight gain, which is causing imbalance in the hormones. There is significant degree of insulin resistance where the insulin is not able to work at the level of the cells, and that is spilling over at the ovaries, which is leading to production of more male-like hormones and ultimately leading to this imbalance. And when we talk about the management, it is pretty much we're coming back to the same, making dietary and lifestyle changes, just like in type 2 diabetes.
Thank you so much. Dr. Anup Mishra sir, how is diabetes different in women? Could you please throw some light on that aspect? Am I audible? First of all. Sir?
Women, there are multiple things that we have to think about. Number one, and my colleague from AIMS and we recently published a paper on this, that the moment they get pregnant, they gain weight, unable to lose weight, and behind that is also absolutely zero physical activity, and the mother's attitude, the more you feed a woman, the better the child will be. And so lots of ghee and lots of carbohydrate and everything. So they gain, say, 5 to 6 kg of weight. They don't. They lose 1 or 2 kg. So a person who's 65 becomes 70. Second child becomes 75. The risk of diabetes is continuously increasing in women. So most of the women think that they are protected against diabetes and they are doing enough work in the household that they think is a physical activity. So they are protected, but suddenly one day the diabetes appears, and that's because of the progressive increase in the weight and inability to do enough exercise, and of course diet. But there is another watershed moment which comes, and that is menopause, perimenopausal state. And perimenopausal state, there is a burst of inflammation there. And some of the studies have clearly shown that the heart risk and diabetes risk goes exponentially high in perimenopausal state, not after menopause, but perimenopause means beginning of menopause. So they may think that, oh, there's another 2 years for menopause and I'm quite okay. They don't even know that after menopause, things will be totally different. So protective hormones are declining already. And they have to step up their lifestyle measures. They don't do. So increasing risk of diabetes, we are looking at almost similar number of women with diabetes versus men. But these women have more weight than men. So a metabolic syndrome, which is a combination of multiple things, and the obesity is more in women in multiple studies, including our own. And then after menopause, if they are not been exercising, they become sarcopenic. What is the meaning of sarcopenia? Their muscles start to wither away, and the fat starts to accumulate in the abdomen. That puts them at risk for, again, decrease in the exercise, increase in the heart risk, increase in the bone risk. So you see how much different it is from the men who have rather uniform trajectory. And if they any point of time they want to reduce their weight, they can reduce weight. Here are multiple social, multiple home interventions which don't let women do the things that are warranted. Of course, behind that is the total lack of awareness in their mothers and themselves also. So these days, I'm seeing more of women with complications. Their livers are majorly enlarged, their kidneys showing protein, and they say, oh, I do a whole of household work, and that's enough. So this is the state of affairs as for women, and next couple of years, women will surpass men as far as diabetes is concerned.
So, a few words about the importance of lowering cholesterol both in men and women, because there are so many myths about it and about the dosages that people have to take, the dosages as advised, and there's so many messages about cholesterol levels in the WhatsApp university. So please clarify this. So,
Dr. Makkar should answer.
was I audible, sir?
Dr. Makkar.
Please, you answer, then I'll. Okay. Whatever.
Dr. Makkar, you'll go ahead and answer that. Your voice is not audible.
Dr. Makkar, please unmute yourself, sir.
Your voice is cracking. Your
Yeah,
voice is cracking.
now your voice is okay now. It was silent earlier. So what he's asking
No,
is,
so I couldn't hear the question properly.
Yeah,
Rajesh, can you repeat that?
I'll tell you the question.
Okay.
What
Okay.
Rakesh
So there
asked.
were two things.
Yeah, please go ahead.
So the importance of normalizing or keeping low cholesterol levels. I think this is a very important.
So, see, diabetes,
Should
as
touch upon.
we just initially discussed, there are long-term complications that happen with uncontrolled diabetes. Now, one of the key denominators in development of type 2 diabetes is insulin resistance. Now, insulin resistance appears, the nomenclature indicates as if there is only resistance to insulin. But this insulin resistance is actually a major metabolic disturbance, which is not only leading to increase in the glucose level, but also leading to abnormalities in the cholesterol levels, increase in blood pressure, increase in the damage to vascular lining, leading to endothelial dysfunction, and promotes deposition of cholesterol in the blood vessels, leading to the increased risk of heart disease or myocardial infarctions or strokes and other things. So, diabetes is considered as a heart disease equivalent, coronary artery disease equivalent. That means a person who has diabetes, type 2 diabetes, and no heart disease, and another person of the same profile who has suffered one heart attack and doesn't have any diabetes, both have the same risk of getting a heart attack. So that is why it is generally recommended that we should treat the people with type 2 diabetes as seriously or as aggressively as we treat people with heart disease. And general recommendation is that all people with type 2 diabetes who have abnormal cholesterol levels or adverse lipid profile over the age of 40 years, all people, irrespective of the lipid profile abnormalities over the age of 40 years, should be treated with statin to bring down the LDL levels to less than 70, which may be low for a normal individual, but for diabetes, we want to keep it lower so that we reduce the risk of heart disease. If somebody has a abnormal lipid profile, even when the age is less than 40 years, all people with diabetes should be on statin therapy, that means the cholesterol lowering medication, and they should be continued for the uh, whole life to prevent the heart disease or heart attacks in individuals with diabetes. Just to inform everyone in the audience that most people with type 2 diabetes, as many as 70 to 80%, will die of a heart disease, not of diabetes. So, prevention of heart disease in people with diabetes is of utmost importance.
Thank you, sir. Thank you. And how has technology changed the management of diabetes over these years? Things are getting smaller, the mobiles are getting smaller. Has that somehow reflected on management of diabetes as well?
Certainly, it is changing a lot of things. So, first thing is the cost of as the technology improves, it becomes more efficient and less expensive. When I came to clinical practice of, I started managing diabetes in clinical practice around maybe 30 years back. I am sure Dr. Anoop Mishra will, also recall those days. The glucose meter used to cost 5,000 rupees. when the salary of a government doctor was only 4,000 rupees. Now a glucose meter costs you 1,500 rupees and has Bluetooth connectivity and apps connected to it and so on. So the relative cost of monitoring has come down significantly. Monitoring has become very accurate. The gadgets have become smaller, more accessible, easy to afford, provide more information. They have connected apps on screens, which gives you not only the glucose readings, they can maintain your diary on phone, on laptop, and the minute you visit the physician, you just show your phone screen have a bird how his levels have been doing. Injection of insulin was a big challenge. We had thick needles, we had to boil syringes. Then we came to disposable syringes. Now we have pens with injectors also. You just need to dial the number and you can inject, and the needles are so thin. We were using needles in the range of 19G. We are using now 23G, which are like virtually painless needles. So everything is changing, and now we have continuous glucose monitoring. We can actually see, record glucose levels every 5 to 15 minutes in a gadget and see how much is the variability in glucose. When during night, how many times this person goes into low levels of glucose or no. So all these information can be gathered, and because this is happening because of the improvement in technology. We are talking of, islet cell transplant, beta cell transplants in people with type 1 diabetes. We are looking at, encapsulation of beta cells, which can be injected or implanted, and this encapsulated beta cell will release insulin when sugar goes up. Otherwise, the insulin increase will not be there. We have insulin infusion pumps. So much has changed in terms of technology, and is making life better for people living with diabetes, is making care of people with diabetes more efficient, more effective, more economical relative to the previous times. But certainly with newer technologies, there is a challenge of cost in countries like India, and availability is also a challenge. So all those things are there, but certainly technology is going to make a lot of difference.
Thank you so much, sir. That
Dr.
was
Mishra,
very
sir, you
interesting.
wanted to comment something on this?
No, I totally agree with you there. That so many things have changed. Only problem remains the still the people who are belonging to low socioeconomic strata. They are, even though the prices have come down as far as technologies are concerned, glucometer is concerned, even they are not able to afford even that and the strips. So whenever you and I are treating such patient, we always have discretionary approach in treating that a poor patient, the cheapest drug yet effective drug, cheapest technology, and less number of investigation, and a person who can afford, we thoroughly investigate them, give them the drugs which have come, which are quite effective, and tell them to buy the best glucometers and so on. So there is, in India, this will always be a problem, always the divide between rich and poor, and a good physician should be able to discriminate that and not give a prescription of very expensive drugs or glucometer to the poor people. That's the only thing I want to say.
So, sir, you have been part of the RSSDA clinical practice recommendation development. And if you look at our clinical practice recommendations, we have put two levels of care. One is the
Yes,
standard care, which should be, the best care possible available to people where the resources are not a constraint. But there is a
absolutely.
minimal level of care which should be provided to all, irrespective of whatever
Yes.
constraints we have.
Okay,
So
thank
that
you.
we have defined there, sir.
I think that's a wonderfully.
Dr. Arora, how does the insulin pump make life? Yes, sir. Sir.
He's asking about insulin pump.
So I,
Yes, sir.
I couldn't get the complete question, so please can you elaborate?
How does the insulin pump make life easy for a type 1 diabetic kid?
Okay. So when we are talking about insulin injections in an ideal world for those who have type 1 diabetes, they they receive a minimum of 4 to 5 injections in a day to optimize the blood sugar levels. But when we are able to replace that with insulin infusion pumps, then that number of injections are gone down from what we talk about 4 times a day to once in 3 days. 3 days. So, firstly, the number of injections goes down. And when we're talking about younger kids, when they are placed on insulin infusion, it makes life very easy for them because every meal that has carbohydrates in it, that is going to rise the blood sugar level. But when we are able to put, use the insulin pump and inject, bolus the insulin, what we call in terms of the insulin infusion pump technology words, that when we are able to bolus insulin through this pump, we are able to deliver for every meal, we are able to deliver the insulin through that tube, and there is no extra additional prick that we are talking about. So it makes life very easy. We also have the one that is newly launched in India this year, that will work in sync with the continuous glucose monitoring sensors and will talk to them and adjust the some degree of basal insulin level to maintain somewhat the blood sugar levels, and the patient does not have to put in a lot of effort in managing these blood sugars except for putting in the meal information through these insulin pumps. So there is a lot that has been achieved in terms of insulin pumps, and it makes life much easier for even for younger kids. There is a lot of resistance that, oh, abhi to chota hai, these kids are very young, I don't want to place them on insulin infusion pumps, but it makes life very easy for them since this is a diagnosis that is there for life, and they have to take insulin until we're able to find a cure. So insulin infusion pump will make life very easy for them.
Thank you so much. I think we had a very interesting and a very useful discussion about diabetes today, being the World Diabetes Day. We need to spread out the message of awareness and prevention of diabetes, and today's topic was very much befitting to this day. So, in the end, I would request each of our honorable panelists to give a small message for our audience. And I will start with Dr. B.M. Makkar, sir. What would be your message for our audience?
So, everybody should, first thing is identify diabetes early, take it seriously, manage it well, and you can live a normal life.
I think Rajesh has gone off.
You can give your message,
Yeah,
sir.
I can give the message and then she can give the message. Yeah. No, my message is very clear that whenever you're doing exercise and diet
Uh,
to maintain the normal body weight, then you have to be consistent and disciplined. If you're inconsistent and disciplined, you say, well, 2 days out of 7 days I'm doing exercise and 2 days I'm doing the diet. That's not enough. So consistency and discipline is most important for prevention of diabetes as well as management of diabetes.
thank
Very well said, sir. So my message actually will be divided into two categories. For one, for those who have type 1 diabetes, I would say that please go to the right specialist first of all. Secondly, please do not try to avoid insulin. A lot of children, a lot of teenagers who are newly diagnosed, they try to avoid insulin and fall in the trap of doing all sorts of alternative therapies before they actually come to the conclusion of starting insulin. But we've lost a lot of time and they're actually losing up, quite, I would say, 3 to 5 years of their lifespan if there's a significant delay in proper treatment. So first, let's not try to avoid insulin if you have the diagnosis of type 1 diabetes. And for those children who are still young and those who are trending towards higher body mass index and have a higher weight, my message to the parents is please get a body mass index growth chart recorded by the pediatrician, track it early, because you may not understand that they're gaining weight. It is just by looking at the growth charts, you will probably know that they are starting to become overweight, and the action needs to be started right from the beginning, right from a very early age, like we talked about in this talk.
Thank you. Thank you so much. Thank you, everyone, for your wonderful messages. Now over to Shehil Rajput ji, sir, for his concluding word of thanks. Sir.
Thank you very much, Dr. Kesri, for keeping the discussion very engaging. And I'm sure all the participants would have learned from huge knowledge and experience that has been shared by our eminent panelists. The moot points that have come about during the discussion, that enormity of the issue is not being understood by most people in our country who can make a significant contribution to avoid a disaster which is in the pipeline and waiting to happen. So we all need to make a concerted effort, bring to more on fore the entire issue, so that as a community we can make a contribution in at least delaying the whole disaster that is waiting to happen. We can't avoid it. At least we can delay it, as doctors have very clearly said that India can't be diabetic free. But if we can reduce the incidence and prevalence going forward, we would have done a human service for our country. And therefore, as a ASSOCHAM body, we should do everything possible from our side to see how we can create more and more awareness on this huge issue that our country is facing. There have been several steps that have been suggested to arrest this problem by our doctors. Technological advancements that are taking place, how both prevention and cure is becoming better by every passing day. Something which was so costly a few years back, which was unaffordable, today it is affordable. And perhaps many people in our country are not even aware that today the management of diabetes is much more affordable, and everybody can monitor it quickly and go to their consultant, the right expert, to take medical help. There are many medicines that are available which can help you lead a normal life if you take good care. Dr. Kakkar has given a very simple message to everybody that you should identify early, take your diabetes very seriously, and manage it well. You can lead a normal life. And Dr. Anup Mishra also said that you need to maintain body weight. You have to be consistent with whatever you're doing, whether your exercise, your diet. It's not that you go like a yo-yo in our life and think that you will be able to live a normal, healthy, happy life in your years to come. It is a serious problem, and everybody has to take it seriously. And Dr. Arora also said that you have to quickly go to the right specialist. If you don't go to the right specialist, you will not get proper treatment. For you to get treated, you have to recognize the problem. Only if you recognize the problem, you will be able to find solution. Otherwise, you will never be able to find solution. And I do hope people who have joined us will take these comments made by our specialist very seriously And I'm sure this will help in them leading a normal life going forward. There is no need to fear from this disease. What is critical is for everybody to recognize and treat it well. There are many solutions available, so we have to recognize those solutions and continue to live a healthy life if you get diabetes in your system. At the same time, if we if we if we focus on what we are consuming, what we are eating, then we can prevent this disease coming to us, because wrong eating habits, not having a healthy lifestyle can become a huge problem for yourself. Thank you very much, all the doctors, and we are really grateful to you from ASSOCHAM for coming and sharing your thoughts with us. Thank you very much, Dr. Kesri, for being partner in sharing this awareness amongst our participants and members. And thank you, ASSOCHAM, for organizing such a wonderful panelists. Thank you very much.
Thank you, sir.
Thank you, Raj,
Thank you.
for this opportunity. Thank you.
Thank you.